So ma'am, there will be n number of patients to fit in, and these days the cases are also becoming so many. So there will be a lot of work pressure. Like so you need to handle so many cases at a time. So how do you handle them?
When the patients come for us, we see the history as I told you. To 5 cycle failure, 6 cycle failure, they are very emotional and very attached to our centers. They want only positive, because they have run for the many centers and finally they came to us. So ma'am also one day she called me up, Swathi, we have to give 100% to these patients. I told, why ma'am? So ma'am told me that no, they are struggling for a long and they are not so much financially also stronger now, because many cycles, 4-5 cycles they have done, and they have only one hope for this. So I was very much under stress that I have a, means every patient is same for me, means I have to give 100%, but this was some special patients that came to our center. When she met a ma'am also, then she came to embryology department and she told, who is embryology over here, I just want to meet. So one of her sister, she told, why ma'am? She was asking to the patient, no, just I want to meet the embryology for one time. So normally we don't meet to the patients. So she was very emotional and she was crying. So sister came and I was in my cabin only. So sister came, madam meeto maatladraniki evaru vacharu. So I told, okay fine, I'll talk. So I went to the patient, what happened ma, tell me. So patient was telling, ma'am meere nade ippudu repi egg pickup unnadi meere ICSI chestara. Why? Means, yeah, we are the team of embryologists. Yeah, we do the. Ma'am, please manchi cheyandi, itla ma cycle fail, and she was literally crying in front of me. Some patient is coming and she was holding her hand to me and she was telling, ma'am please నాకు ఈసారి ఎట్లన్నా నాకు పాజిటివ్ రావాలా, నాకు ఇట్లా స్ట్రగుల్ ఉన్నది లేదంటే అదే. She was telling about the family history and everything. This is my 5th cycle, they are blaming on me only, my eggs are only not good, my husband's sperms are good, so there is something fault in me also. It was so emotionally I was attached to that patient. So I prayed a lot when her pickup came. When I did ICSI first time means every patient is very near and dear to me. So when I was doing ICSI, so I just prayed to God that I have to give embryos to this couple. So the couple has retrieved, AMH was low, only 6 only we have retrieved, 6 oocytes only we have retrieved. So when the AMH is low, the eggs also retrieval is very less. 6 M2s only we have retrieved, 6 only I have injected, the best sperms I have taken, and I have done the ICSI. The next day when I came, whole night I was in nightmares for me, what will happen, because that patient personally came and requested, she was doing please dandalamma, she was talking in Telugu and all that. So she was telling, I told okay, whole nightmare for me actually this patient's came. So when I was checking FERT, so I was thinking, oh my god, all has to be in FERT and it has to be in good only. So all 6 was fertilized, and okay, then first stage is completed of this stage. So next day also I prayed a lot. On day 3 I have checked, a beautiful embryos, a textbook embryos it was formed, means all 8 cells only. And when there is a symmetry is good, everything is good, a little 100% hope it will be that it will yield for a blast. So all embryos we have taken to day 5. It is a small case, we was thinking that shall we take or no, shall we take on, because this is a failure cycle, right? So at least nothing will yield, or because one time what means for the few embryos the genetic abnormalities, if it will be on day 3 it will look very beautiful, but that all embryos not yield for a blast. So it is very dilemma to me and ma'am also. I was telling ma'am, we will take a chance, because looking to the embryos the symmetry is very good, and we will take a chance. Ma'am was telling, shall we take or no, that patient is very emotionally, last cycle day 3 embryos we will freeze and we will transfer, at least one cycle will be. I was telling, any cycle failure is there na ma'am, we will see, if we are going to give, we have to give best to the patient only. So all on day 5 I have not checked the dish. I was beside the ICSI machine, and my colleague, I told, please, when you check the dish, you please tell there is a blast. There is a good grade of blast on it. So then she checked. We keep a culture drops are there, 3 drops like that. So we keep the grades embryos. So when she saw, she told, ma'am, first drop la blast unnadi. Oh my God, thanks God, I told. Then second drop also she told, embryos are there, a blast is there, ma'am. So I was so happy for that. Third drop also was there, embryos, blast was there. So all 6 embryos, it yield a good blastosmere. So I was so happy. My happiness was in the world only that anyhow many cycles she has not yield a blast only. So all 6 embryos, what we from the day one we was doing observing. So all 6 embryos, it yield a blast, beautiful blastomere. It was about to hatch. We has a grading system, and all embryos we have frozen. In 1/2 we have frozen, and when she came means next month after the cycle, next month she will come for frozen embryo transfer. Then she came prior day. She asked, a madam unnara. I was on the leave that day. So morning she came to the center. I went at 9 o'clock. She came morning. She was about near the center only. Before I enter, madam, she hold me a lot. Then I see multiple patient will come, but this patient was very special. I know her name. I have seen her face and have had a talk with her. And she told, madam, మీరు వచ్చారా, నాది వాళ్ళ ఎఫ్ఈటీ ఉన్నది. ఐ టోల్, ఓకే మీ ఎఫ్ఈటీ ఉన్నదా, ఓకే ఏం వరీ కాకండి, బెస్టే అయింది ఇప్పుడు దాకా, ఇది మంచి జరుగుతుంది, మీరు ఫ్రీజింగ్ అయింది, బ్లాస్ట్ అయింది, అంత చిన్న అంటే ఎంత తక్కువ వచ్చినాక అన్ని బ్లాస్ట్ వచ్చింది, థ్యాంక్ యూ, మీరు దేవుడమ్మా. షీ టోల్ మీ, నేనేం దేవుడు లేదు, దేవుడు నాతో చేపిస్తుండు, అది నేను థ్యాంక్స్ అనాలా మీకు, దేవుడికి, అందరికీ, దట్ నాకు ఏదో మంచి చేయడానికి ఇచ్చారు. సో ఐఎమ్ డూయింగ్ దట్. ఎంబ్రియో ట్రాన్స్ఫర్ ఆల్సో, embryos was very beautifully, is completely hatched. It hatched out. So hopefully it was 100%, means 99% I was thinking it will get implanted. So ET has been smoothly, everything has been done. Again while going she told that thank you madam. నేను థ్యాంక్ యూ ఏమన్నా, మెడిసిన్స్ మంచిగా తీసుకోండి, ఆరోగ్యం చూసుకోండి, మంచి ఫుడ్ గిట్టు తీసుకోండి, హీట్ వస్తువులు ఏం తినకండి, యాజ్ ఇన్స్ట్రక్షన్స్ ఇస్తారు మీకు సిస్టర్ అండ్ మేడం కూడా చెప్పిండి, జాగ్రత్త ఉండండి, అంతనే నా దగ్గర నుంచి, ఆల్ ది బెస్ట్ అండి. So after 15 days beta ICG will be there. So she came with the fear that only, that what will be the result, and I also were desperately waiting for the result. So on that day also I know that because we have
done 2 embryo transfer,
two embryo transfers. Yeah. And in the registers also we'll write, means today this patient beta ICG and all that, every day we'll have an update. So I knew that this patient is there. Before day only I will see tomorrow what beta ICGs are there. So end of the day I will write beta ICGs, everything. So that patient came early morning only, she was there in the center again. So madam nadi val beta ICG unnadi, she told. That day I was little 5 or 10 minutes late. She was waiting at me and she asked some of the sister, madam వచ్చారా embryology madam. Then ఇంకా రాలేదండి, కూర్చోండి they told. Then okay fine, I told, they sat and they were still waiting for me. ఇవాళ మా బీటా ఎస్సీజీ ఉన్నది అండి, he told. Then okay నా, ఆల్ ది బెస్ట్, ఏం వరీ కాకండి, మంచిగా జరుగుతుంది, దేవుడి పైన విశ్వాసం పెట్టండి, I told. Okay, then she has given blood test and all that and she went off. Then end of the day I was waiting for the result. When the result came, the happiest in the center are me and madam only, means more happiest. And that day I gave chocolates to everyone, that the patient don't know that still it is positive. Next day she came to the center and she gave sweets to everyone. Chana thanks andi, atla itla, she told that it was the happiest moment, that something we made her happy while giving a pregnancy, and only the instructions we have given that this you have to come with the healthy baby in the center. So now she is carrying over 6th month, something like that. And recently on embryology day also she came for the cake cutting, that what are the positive people, means couples are there, we called them for the celebrations and all that. Then she also express her view in front of all patients who were sitting that I have got pregnancy here after so many years and all that. That time also she, in her eyes it was tears. I told don't cry, everything will be. And now she is carrying 6 months. Hopefully in this 3 months she will come with the baby.
So it's a single baby or twins, ma'am?
It is single baby.
Okay. So one embryo got implanted.
Yes, yes, yes. That is a beautiful experience in my this life. That means one patient from the day one she is coming and meeting. That is very different from the other patients that normally we don't have much contact with the patients, right? In the hospital, we just directly when we enter in the lab, enter in the center, we directly go in the lab because we have multiple works in the lab, and we are very frequently meetings of patients and everything. Only during the embryo transfer also, just we'll add the confirmation name and all that, all this stuff. And few patients only we know by facing, talking, explanation and all that.